The purpose of this presentation is to analyse the new public health issue housing access. We will begin by defining housing accessibility and homelessness, supported by demographical data, before deconstructing the Red Lotus model of health to explore the individual and environmental determinants that impact our public health issue.
Housing access is defined as the salutogenic approach to the right to safe, stable, and affordable shelter. Housing is a prominent determinant of health where the majority of people spend large proportions of their time, thus highlighting the significant impact it has on our well-being. Salutogenesis, introduced in 1968, is a term used to describe the focus on specific factors that cause and facilitate health, and will be applied throughout this presentation.
All individuals that seek specialist homelessness services are characterised as either homeless or at risk of homelessness. To be classified as homeless, individuals possess no shelter, no temporary accommodation, or may own a house with no tenure. Those at risk of homelessness may be residing in public, community, or institutionalised housing. In 2016 to 2017, 288,273 Australians were identified as being homeless or at risk of homelessness, equating to almost 1 out of every 100. This is a significant quantity of our population, as this map highlights the concentrated regions where homelessness is more common. New South Wales, Victoria, and Queensland experience approximately 40 per 100,000 homeless. However, this number in the Northern Territory currently sits at 600 out of every 10,000.
These graphs highlight those who are impacted the most by housing access. The distribution of homelessness throughout age groups was surprisingly equivalent, whilst females were significantly higher at risk than males.
Those who are a single parent are at higher risk of experiencing housing accessibility issues, while 89% of all homeless people are either unemployed or not in the labour force. We also found that the main reason for seeking assistance was accommodation issues, including housing crisis, tenancy loss, or eviction. This was closely followed by interpersonal relationship issues, accounting from family breakdown to domestic violence. A priority population group we examined were Indigenous Australians. Aboriginal and Torres Strait Islanders represent 25% of the population homeless or at risk, with 1 out of every 15 currently receiving support from a homelessness agency. They are also 15 times more likely to be sleeping rough than non-Indigenous Australians. Indigenous women are 35 times more likely to experience family violence, with the potential to leave them homeless. Indigenous people experience harsh discrimination within the housing system, with a shortage of culturally appropriate properties, which results in overcrowded homes. Aboriginals also exhibit a strong spiritual relationship with the land, which can become disconnected, effectively rendering them spiritually homeless. Appreciating a social justice approach means respecting Aboriginals as the traditional owners of this land, understanding their cultural practices and their right to self-determination.
The Red Lotus model was first proposed in 2007 as an augmented model of health that incorporated a values and principles system. This model focuses on an ecological, holistic, and salutogenic framework, supported through a social justice approach.
Some behavioural determinants that may result in homelessness include problematic gambling, alcohol and drug abuse, domestic violence, and antisocial behaviour. Psychological conditions are prevalent amongst homeless people, which may arise from a myriad of social, behavioural, and cognitive determinants. Loss of family connection or family breakdown may be a result of unemployment or a loss of income, highlighting the interlink between behavioural and socio-economic determinants, and can potentially trigger criminal activity. Homeless people experience higher mortality rates, higher occurrences of acute and chronic conditions in association with lower life expectancies of up to 20 years, with approximately 85% of homeless people daily smokers. They often lack healthy relationships and have a poor social connectedness, which may give rise to a disengagement at school from a lack of family support. Some biological determinants may include an individual's age, as discussed earlier, the equal dispersion of homeless people throughout each age bracket, as well as gender. Genetics play a major role in the determination of homelessness, in the sense that you are far more likely to be homeless if you are born into poverty. A lack of education may hinder a homeless person's ability to make safe and rational decisions to improve their health and well-being. A cognitive function they may exhibit is a sense of desperation and depletion, leaving them to believe they are destined to be homeless forever, regardless of their actions. Those who are born into low socioeconomic areas experience significantly higher rates of being at risk or homeless. A loss of income or a considerably poor income, compounded by structural factors such as a lack of appropriate housing, poor economic conditions, and a competitive housing market, contributes to higher volumes of homelessness. The first petal layer of the red lotus plant symbolizes a plethora of environmental determinants that exist under 5 specific subsections. Economic determinants represent the availability of safe and affordable housing, accounting for the possibility of rental and mortgage areas. It is not uncommon for homeless people to potentially owe large amounts of money or have severe debt. Australia has one of the costliest housing markets in the world, adding to the already strenuous conditions homeless people suffer in Australia.
For homelessness to exist, people must lack a safe and appropriate place to live, highlighting the absence of access to the built environment, with up to 6% of homeless people staying in improvised dwellings or sleeping rough. A considerable number of those who have been evicted from former tenancies. Those at risk may have temporary accommodation. However, it is likely to be overcrowded, heightening the likelihood of spread of disease, significantly impacting their health and well-being.
Housing and living conditions are both in themselves a social determinant of health that directly impact the homeless. Furthermore, the lack of community support coupled by poor social and community networks add to the poor living standards they exhibit. Other social determinants influencing the homeless may include education, access and knowledge regarding available health systems, and access to clean water, air, as well as food security. With up to 30% just released from prison, homeless people will undoubtedly struggle to transition back into society. A salutogenic approach to this issue is implementing government-funded programs assisting that transition, so they are able to function correctly and benefit our society.
Because a large quantity of homeless people are compelled to live outside, the natural environment has an explicit and devastating effect on their everyday life. Global warming denotes the increase in global atmospheric conditions as a result of an increased carbon dioxide emissions. A myriad of scientific studies illustrate the existence of global warming and the consequence it has on the weather, highlighting an increase in the number and volume of wild weather systems. As an ecological approach states, health is created through an interplay of an individual and their environment. This clearly influences the everyday lives of homeless Australians.
A political network of support has been implemented in Australia to assist those who are homeless or at risk of homelessness. The Department of Human Services offers rent assistance as well as rent deduction scheme, which allows individuals' rent to be deducted from government payments. In addition, the government has provided funding through the National Affordable Housing Agreement and the National Partnership Agreement on Homelessness, both being reformed into the National Housing and Homelessness Agreement, which will provide $375.3 million over the next 3 years in an attempt to tackle homelessness. The government has also promised $23 million towards the Reconnect program, an early intervention community-based program that assists young people who are at risk of homelessness.
A safe and secure home for people would lead to improved mental and physical health. This may lead to employment, higher education, and overall a healthier community. It would also decline the frequent admission to health and crisis services, as well as correctional and mental health facilities. This would cut taxpayers' costs on those services. Having appropriate housing for people transitioning from prison, health care, or mental health facilities would prevent reoffending and reincarceration.
This presentation explored the public health issue of housing access through an ecological and salutogenic framework, reinforced with a social justice perspective using the Red Lotus model of health as a guide. An abundance of environmental and individual determinants were explored to show the interlink between determinants and the effect they illustrate on health and well-being. Those that are predominantly affected include females, people in their age group 25 to 34, the unemployed, Indigenous people, and parents living by themselves with their children. People seeking support from agencies has increased over time, and Northern Territory stands out with significantly higher rates of concentrated poverty. We should all be incentivised to end homelessness, to ensure equality throughout Australia is achieved, as well as the fact that the economic burden they generate is funded through taxpayer money.